Hi, I'm Douglas Flemons, and I'm here with Scott Poland. You are a school psychologist, and we have worked together for over 10 years. And you came here from Texas, where you were the head of a big program for school psychology for a whole area of the state.
Yes, it was one of the largest districts in Texas, and I was the director there. And I got particularly interested in the area of school crisis, in the area of youth violence and suicide prevention. And sadly, we had 4 different school shootings where I worked. We had many suicides, and that got me really interested in the whole area of crisis prevention, intervention, and postvention. And I started writing books and chapters on school crisis, mostly because I want to prevent tragedies from occurring that affect young people in schools.
Our course on suicide prevention is really geared to doing that.
Absolutely. And very importantly, you, along with Dr. Gralnick, wrote a book about suicide assessment and relational suicide assessment. We use that book in our course, and really, mental health professionals in so many fields need to have better skills in suicide assessment and management.
So you'll discover if you take the class, we co-teach it, and we do it like this. And it's a nice compliment because you're a school psychologist, I'm a family therapist, and my background is very different, but I think it dovetails very nicely with you. In addition to being a professor of family therapy and thinking then about suicide from a family kind of perspective, I was the director of a student counseling center for 6.5 years, and Dr. Grelnick, who you mentioned, was the psychiatrist who worked with me. And so our interest, my very focused interest in suicide assessment came out of running that clinic.
Absolutely, and you probably remember how we met. Maybe the first week I was here, tragically there was the death of a student, and we were both asked to respond to the medical school, and we really formed a bond. And at that time, Nova was looking at suicide prevention university-wide, and that resulted in you and I becoming co-directors of NSU's Suicide and Violence Prevention Office.
Right, so we have this multiple roles. We're teaching this class together, we run this office together, and then we each have our own responsibilities as faculty members. This class, which is focused on suicide prevention, covers assessment, so as you mentioned, but we're also looking at a bunch of other facets of prevention.
We're really looking at suicide across ages. There is certainly a lot of concern and national data indicating suicide maybe at the highest level in 20 years.
Yes.
There's concern about middle school girls that have had a dramatic increase in suicide rates. There's concerns about men in the age group of like 35 to 55. And then we've always been very concerned about suicide in the elderly.
So we want you in this class to be able to discover how to think effectively about suicide prevention and to be able to be proactive in making a difference in your community.
And we've both been very involved at the state and the national level in terms of service to organizations and presentations. And I'm really proud to say that along with my wife, a former principal, we recently authored the Suicide Safer School Plan for the entire state of Texas.
Yep, so we come with full of resources, so much experience, and we look forward to you taking our class.
Absolutely.